So it's another refreshing time on your program Agenda 2030, and it's a moment to bring you reports of development efforts by stakeholders in pursuant to the attainment of the Sustainable Development Goals. I am Toyin Kamyang John. As usual, today's episode promises to be insightful, and we hope you'll have a swell time to sit back and savour it as we unveil the package to you after this break. Stay with us.
Agenda 2030. As a successor framework for the Millennium Development Goals, the global community rolled out a bigger, deeper, and more encompassing framework called the Sustainable Development Goals, designed to transform our world, lift the poor out of poverty, as well as ensure inclusive and healthy society. On Agenda 2030, we take you on a media trip to the global destination of the future we want. With everyone on board, we focus on the people and their struggle, the civil society and their agitations, the government and her development effort, the global development agenda, its 17 goals and 169 targets. We bring you all the deliberations, insightful conversations and high-level partnerships on the road to global destination. Agenda 2030, showing on this channel. Agenda 2030, leaving no one behind.
Thanks for staying tuned. Remember, you can always watch this program and other episodes by subscribing to our YouTube channels on youtube.com/Fresh News TV and youtube.com/Agenda 2030 TV. You can also watch the program live on Facebook. Just log on to www.facebook.com/Fresh News NG and www.facebook.com/Agenda 2030 TV. Follow us on all our social media platforms at Agenda 2030 TV on Facebook, Twitter, and Instagram. Remember to drop your comments and share with your contacts. Do use the hashtag Agenda 2030 and hashtag Agenda 2030 TV.
Nigeria will continue to support the United Nations in all its efforts, including the attainment of the 2030 Agenda for Sustainable Development. I thank you.
Agenda 2030, showing on this channel. Agenda 2030, leaving no one behind.
To better chronicle the impact of the Sustainable Development Goals in Nigeria, as well as monitor its programs and progress, it is important to put in place a workable data collection and dissemination system for proper tracking, monitoring, and evaluation in the noble bid to leave no one behind. In this light, partnership has also been identified as key factor. It was therefore against this backdrop that research delegates from Aid Data at the College of William and Mary, USA, paid a courtesy visit to the Office of the Senior Special Assistant to the President on Sustainable Development Goals to ascertain and share credible data with a view to driving strategic planning for the implementation of the global goal, while also benchmarking progress made. The report.
Addressing the needs of orphans and vulnerable children is important to the issues hampering the attainment of the sustainable development. To effectively carry this out, investments are targeted at the disadvantaged in order to translate plans into results. Against this background, assembling the relevant data on orphans and vulnerable children will assist policymakers and program implementers to make evidence-based decisions on how to best direct funding and activities to maximize outcomes. It is in this light that the researchers at Aid Data recently visited the Office of the Senior Special Assistant to the President on Sustainable Development Goals in Abuja. The Secretary of Programs in the SDGs office, Alhaji Waziri Laminu, who received the team of researchers, emphasized the importance of data collation to the implementation of the SDGs, while also revealing plans to further integrate vulnerable groups and out-of-school children into the SDGs.
We have quite some ideas, and we have started a pilot program in 4 states, and working with those states, because for us here we want to actually let the actors act rather than for us to do the implementation ourselves as the SDGs due to the issues of funding and manpower and all that. So we encourage them and we work with those states, and of course the Ministry of Education with UNESCO and UBEC and all the other agencies to achieve those objectives.
Professor at the College of William and Mary, Dr. Iyabo Obasanjo, while speaking about using data to track progress in the implementation of the SDGs in Nigeria, commended the efforts of the Nigerian government in view of the progress since the agenda came into effect.
I'm impressed by the amount of work that is going on in tracking the SDGs. There are a lot of indicators to monitor, over 200, and slowly the office is kind of getting those indicators aligned, and that is very important. If you don't know, and then they've already done a baseline study of where all those indicators are, or trying to do that, which is really the start of the process. If you don't know where you are, you can't kind of monitor. You won't know how things have changed over time.
On how vulnerable groups are being accounted for in the SDGs data collation process, researcher at Aid Data, Jennifer Turner, says Nigeria has made impressive efforts towards implementing and integrating vulnerable orphaned and out-of-school children into the activities of the SDGs, but will need to sustain the efforts to reach full attainment by 2030.
I think it's just continuing the process that's underway. There are so many needs, and so it's hard to, with everything that we need to do, being able to achieve progress on everything, but looking at what are these priority areas, how can we address those, and continuing to integrate these vulnerable groups into the system as a whole. I think there's a lot of progress being made. There's always more to be done, and so just continuing that progress that's already being carried out now.
In a bid to stem the tide of abuses, domestic violence, and infringement of the rights of the vulnerable in the society, the Office of the Senior Special Assistant to the President on Sustainable Development Goals has launched a war against unscrupulous violators in a strategic partnership with the Nigeria Bar Association. Princess Adejoke Orelokwe Adefulire, the Senior Special Assistant to the President on SDGs, made this revelation while handing over operational buses to Mr. Wakar Mahmood, the President of the Nigeria Bar Association, NBA, in Abuja.
As you know, the Nigeria Bar Association has signed an MOU with the Office of the President on Sustainable Development Goals, and especially focus on Goal 16, which has to do with access to justice and sustainable institutions. For a long time, this has been part of our public interest engagements. We have a very broad, several initiatives and lined up a number of programs which we've been pursuing. And this engagement and partnership with the Office of the President will certainly assist us, especially in the kind of support we've been getting from them, the resources and the logistics support. And this morning we are receiving 2 brand new buses, which definitely will go a long way to improve our access to all the communities that we try to reach through these programs. Our focus is on pro bono legal services, especially to victims of various conflicts across the country and human rights abuses. And so that has been the focus. We have a lot of activities in the Northeast, in the North Central region, and obviously also in South-South. So this is generally the focus, and we're hoping that this support will go a long way to facilitate our activities in those areas.
Like our slogan says, stronger together. If you want to make the weak strong, you must have access to justice. But because they are poor, they take advantage of them. And I think that we can't be going, there's not enough resources to go around to provide those services, rather than partner with those people that have opportunity and the spread, the capacity, and what it takes to provide the justice, to seek for the justice for the poor. So we believe that Nigeria Bar Association has the capacity. Today we are providing some logistics support for them to be able to work effectively to ensure that the voiceless has a voice. We want to get to the poor of the poor, the most vulnerable, and that's the only way that you can reduce violence. If you know that the poor can get access to justice, the perpetrator will stop.
Also, in a bid to achieve Goal 8 of the Global Goals for Sustainable Development, which is promoting decent work and economic growth, the Senior Special Assistant to the President on SDGs, Princess Adejoke Orelokwe Adefulire, at an event in Abuja, to disburse loans to some youths trained under the UNESCO TAP project, called on youths to embrace skills acquisition programs in order to guarantee self-reliance in the future. We have the report.
We want more people to be on job, to have a job to do. It's only when you have a job to do that you can take care of yourself, take care of your family, take care of your parents that have invested in you, so that you too can pay back to take care of your aged parents. So we want us to look at ways in which we can create more jobs, but we have to find a way around it to be employer of labor ourselves. There's a limit to what government can employ, and the Economic Recovery and Growth Plan of Nigeria government is working with the manufacturing company, and we are working also with the foreign investors to come to Nigeria to invest so that we can have job opportunities. We are talking to the local investors and we are talking to foreign investors. Some are in town now working with the Nigeria government to establish in Nigeria so that you can have job to do.
One of the cardinal provisions of the 2030 Agenda for Sustainable Development is the guarantee of good health and well-being. The goal has as part of its targets prevention of infant and maternal mortality. In the quest by the federal government to ensure that no woman dies while giving birth, the Office of the Senior Special Assistant to the President on SDGs recently handed over some primary health care centers sited and constructed in some rural communities in Kaduna State to the communities for usage.
Their joy knew no bounds. The people of Bakin-Kasuwa, Chukum local government area in Kaduna State had every reason to jubilate, celebrate, and heave a heavy sigh of relief when recently the Senior Special Assistant to President Muhammadu Buhari on Sustainable Development Goals, Princess Adejoke Orelope Adefurile, visited the community to hand over to them the healthcare facility constructed in partnership with the state government. For years, they have survived without the presence of healthcare facilities in their immediate environment. They have been forced to travel long distances to access medical attention when the need arises. This situation has forced the pregnant women among them to resolve to self-help when giving birth, or at best, patronize the traditional birth attendants with dire consequences in most cases. But hope located them. They, today, find succor in the construction of a fully equipped primary health care facility jointly provided by the Office of the Senior Special Assistant to the President on SDGs and the Kaduna State Government.
It is my pleasure to be here this afternoon to join His Excellency, the Deputy Governor of Kaduna State, to commission this important facility for the benefit of our children, our women, especially the pregnant women, and for the need for us to also get this facility available to reduce maternal death and infant mortality in this community. I'm highly honored to be here, and I want to thank the Deputy Governor as well as the Governor and their dear brother who is in charge of this project, the Honorable Commissioner for Planning and Project Commission, for being focused and for their foresight and in ensuring that this project is timely delivered. I was told that the project has been put into use for this community. It's a pledge that we continue to work with the Kaduna State government to provide more of this facility for the benefit of the people of Kaduna State and Nigeria in general. So this, therefore, my privilege and honor to commission this project in the name of God the Father, God the Son, and God the Spirit. Amen.
The Primary Healthcare Center is one of the numerous projects valued at 1.2 billion jointly delivered to Kaduna State. The total project, numbering 124, covered upgrade and construction of primary healthcare centers, perimeter fencing, toilet facilities, staff quarters, solar-powered boreholes, and procurement of hospital equipment. Speaking at the event, Governor Nasiru El-Rufai, represented by his deputy, Barnabas Bantex, said that the projects were located in the 6 local government areas with highest number of maternal and infant mortality in the state. He identified the local government areas as Chukum, Kaura, Kachia, Igabi, Kubau, and Ikara. He thanked the Office of the Senior Special Assistant to the President on SDGs for supporting Kaduna State in its quest to improve the quality of life of citizens through the provision of quality health care.
The 6 critical projects being commissioned today are spread across 6 local government areas: Chukun, Igabi, Ikara, Kubau, Kaura, and Kachia, to address the problems of vulnerable communities ravaged by some preventable diseases and high infant and maternal mortality rates. Distinguished ladies and gentlemen, these projects were conceived during the MDGs days. They consist of upgrades of primary health care facilities, construction of a perimeter wall fence, construction of toilet facilities, construction of staff quarters, construction of solar-powered boreholes, and supply of essential hospital equipment. The commitment of the Kaduna State government to the successful delivery of this project informed our decision to provide 600 million as matching grant in the 2016 budget. We had no doubt that projects like these would help improve health outcomes for our people. At this juncture, may I appeal to the Senior Special Assistant to the President on SDGs to always consider Kaduna in critical projects, and we assure you of our total commitment to provide the matching grant that may be required from the state government at all times.
Inaugurating the projects, Princess Adejoke Orilope Adefurile, the Senior Special Assistant to the President on Sustainable Development Goals, said they were executed to increase access to quality healthcare services, particularly to pregnant women and nursing mothers. The presidential aide said that the projects were implemented under the conditional grant scheme of her office and pledged to continue working with the state in providing more healthcare facilities in rural communities. According to Princess Adejoke Orilope Adefurile, the society cannot talk about ending maternal and infant deaths when rural population do not have access to healthcare services.
Those that are pregnant already, the need for them to attend antenatal clinic. With this, you save a lot of deaths, because when you have a record in the primary health care center, since the day that you register, so when there's complication, they quickly trace your files, you know what actually went wrong, because they have your record. But if you don't attend, when you come on emergency, no reference, because you don't have a file that they will refer to. So there won't be any reference. So to treat you, the caregiver might find it very difficult to treat your history, your medical history. So if it's possible for us to eradicate, we will eradicate. But it has given a significant decrease in the number of women that give birth at home, and it's a very high risk. So putting this in place now will give a lot of comfort, opportunity for the pregnant women and the nursing mothers also to immunize their children. So we'll continue to partner with Kaduna State government in this life-saving program for the benefit of Kaduna and the entire country, Nigeria.
She also added that her office is working with Kaduna State and other states across the country to improve the quality of lives of Nigerians through various interventions in economic, social, and environmental lives of the people. Muhammad Abdullahi, Commissioner, Planning and Budget in the state, explained that the projects became necessary after a survey in 2016 which indicated that 70% of pregnant women in the state deliver their babies at home, a situation that led to a high level of maternal and infant mortality in the state, particularly in the local government areas where the projects were cited.
These projects, being represented here by the one in Chukun local government, are spread across 6 local governments of Kaduna State. the reason that these 6 local governments were chosen, Your Excellencies, is because out of our work with the Ministry of Health and Human Services, the UNICEF and other health expert agencies, we discovered that these 6 local governments have the worst statistics in terms of maternal health. That is to say that these 6 local governments is where we are losing the most women when it comes to childbirth. This is where we are losing a lot of our sisters, our mothers, our daughters when it comes to childbirth. So in 2016, when we discussed with the Office of the Senior Special Assistant to the President, they graciously agreed to provide some funding for us as a state government if we will be able to provide equal and matching funding. This is what we did in 2016, and this gave birth to these primary healthcare centers that you are seeing here today. So the objectives of these centers across these 6 local governments, cutting across all the zones of the state, were to increase the attendance of pregnant women and adolescent girls for ANC, to increase skilled birth attendance, because we discovered that one of the major reasons why we were losing these women was because they were dying because there was no skilled attendance at birth, and to also provide that minimum level of health care at this level.
Honorable Yari Marcus, the representative of the people of Chukum in the State House of Assembly, expressed their appreciation of the people and added that the health facilities will significantly improve the health outcome of the state through increased access to quality health care services.
This is one of the projects we have been yearning for. This is a grassroots project where it's going to cater for maternity and so many other child illnesses. So this is a hospital that is first of its kind to be built in this community. So I'm so happy because we have 4 of these type of projects that have been given to my constituency. So I'm happy today. Many things will be put into use. I'm very happy for the Office of the Special Assistant to the SDGs, to the Excellency on SDGs. I'm so happy. And I pray that God should continue to keep this section for the betterment of our people.
Nigeria will continue to support the United Nations in all its efforts, including the attainment of the 2030 Agenda for Sustainable Development. I thank you.
Agenda 2030, showing on this channel. Agenda 2030, leaving no one behind.
And that's our package this week. Before we go, let's quickly remind you that you can always watch this program and other episodes by subscribing to our YouTube channels on youtube.com/Fresh News TV and youtube.com/Agenda 2030 TV. You can also watch the program live on Facebook. Just log on to www.facebook.com/Fresh News NG and www.facebook.com/Agenda 2030 TV. Follow us on all our social media platforms at Agenda 2030 TV on Facebook, Twitter, and Instagram. Remember to drop your comments and share with your contacts. Do use the hashtag Agenda 2030 and hashtag Agenda 2030 TV.
I'm Jennifer Turner from Aid Data in the United States. I think we should all keep watching Agenda 2030 TV.
My name is Lawrence Chidi-Anukam. I'm the Director General of the National Environmental Standards and Regulation Enforcement Agency, NESRA. I support Agenda 2030. I implore everybody to keep on watching.
Thank you very much for being part of the program. I am Tony and Kamian John. See you again next week. Bye.